Around, around, around she goes. Where she stops. Okay. All right. It says we're live. Hey guys, what's going on? So this is actually an update from yesterday. So this was at the president's daily briefing yesterday. My apologies, I got a little bit behind on things, but we're doing the update here. The main point we want to take away from this is that the president has extended social distancing guidelines for the country through April 30th. So, again, in my opinion, it looks like we're more or less going to kind of be going on as we are through the end of April, at least for what it looks like right now. So let's just get the president's opening remarks, get a little commentary here, and see what's going on. A lot of you folks may have seen it, but you know what? Let's catch up. So, I hit the wrong
Appreciate
thing.
everybody being here.
Thank you.
Beautiful day in the Rose Garden. Tremendous distance between chairs. Social distancing. You practice it very well. We appreciate it. That's great. I want to start today by highlighting several critical developments on both the testing and treatment that will help us win our war against the coronavirus. On Friday, the FDA authorized a new test developed by Abbott Labs that delivers lightning-fast results in as little as 5 minutes. That's a whole new
Wow.
ball game.
How's the
I
accuracy?
want to thank
That would be
Abbott Labs
amazing.
for the incredible work they've done. They've been working round the clock. Normally, this approval process from the FDA would take 10 months and even longer, but we did it in 4 weeks. Abbott has stated that they will begin delivering 50,000 tests each day.
Desperate times,
Starting
desperate
this week, and
measures.
as you know, even before this development, we've been doing more tests than any other country anywhere in the world.
Yeah.
It's one of the reasons that we have more cases than other
Well, because we've
countries.
confirmed them.
Because we've been testing. It's also one of the reasons that we're just about the lowest in terms of mortality rate, because we've been doing more testing, so we have bigger numbers to look at.
This
I
is
want
something
to
no one's dealt
also
with.
thank General Semonite of the Army Corps of Engineers and General Pavlovicek, who's here with us, who's going to say a few words in a little while. What the Army Corps of Engineers did, along with FEMA in New York, was incredible. They built 2,900
Wow.
beds worth of hospital, an
Really
incredible hospital.
Pop
the
in,
shopping
refab
center,
an
which I mean,
entire place.
and I
Dude,
just
those folks
wanna
don't mess
say that
around.
was Unreal. They did it in less than 4 days.
Oh, jeez.
People have never seen anything like that.
Don't doubt what we
And
can
it's
do.
An incredible, complex, top-of-the-line hospital. They did it so quickly. Everyone's trying to figure out how they did it, including me, and I was a good builder. But they did it very quickly, Mike. So we're very happy. So I want to thank
crank it
Army
out.
Corps of Engineers, FEMA, the incredible job they have done. Now they're moving to other locations throughout the country.
We ain't
where
messing
they
around with
already have
this. This
people
is
building
important.
hospitals. We're doing them in Louisiana and New Jersey, many other places. But these are incredible men and women, and they worked around the clock. And the people of New York are very happy. Governor Cuomo expressed his thanks, which we appreciate. But these are, there's nobody could have done a job like that.
This is, I think, a big point because I believe I just heard Mayor de Blasio a little bit earlier today stating that by the beginning of May, New York City likely will be needing upwards of 60,000 beds. So, I mean, this is so important. Continue, Mr. President.
Most people have never seen anything like it. The deployment of rapid testing will vastly accelerate our ability to monitor, track, contain, and ultimately defeat the virus. We will defeat the virus. It will also allow us to test doctors, nurses, and other healthcare workers immediately and enable us to act quickly and aggressively to shut down the spread of the virus. So important.
More data is
Facilities
important.
like hospitals and nursing homes. And we will ensure that we can give cities and states the best information to guide local decision makers in making. I want to point out that the hydroxychloroquine is being administered to 1,100 patients.
As
people
prescribed by a
in New
doctor.
York, along with the Z-Pak, which is azithromycin. And
As well as some zinc, I believe.
it's very early yet. It started 2 days ago. But we
It
will see what
sounds
happens. I
promising,
wanna
but
thank Stephen
I'm also
Hahn,
hearing
who's
side effects.
a great doctor, left one of the best jobs in our country, running
People just need to know the risks.
an incredible hospital in Texas. And he's the head of the FDA, and Stephen got approval for that so fast. Let's see how it works. It may not.
Let's hope it saves
But,
lives.
we may have some incredible results. We're going to know soon. So it's being tested on 1,100 people in New York.
Okay.
The FDA is also allowing the emergency use of a blood-related therapy called convalescent plasma
Swapping
as an
out
experimental treatment
folks
for
with
seriously
antibodies.
ill patients. This treatment involves taking blood plasma from patients who have already recovered from the virus. So they're recovered, they're strong, something was good in them that worked. And so we take the plasma from those people that have recovered so well, meaning their plasma is rich in antibodies against the virus, and transfusing it into sick patients very, very, very powerfully. So sick patients will
As I start coughing.
be transfused with the
Nope, you're going to have to
blood
sanitize.
taken to boost their immune system. We'll see what happens. And we're having some early results that are good, but we will see. And that's going, I think, very rapidly. Again, we got approvals in really very quick time. We're also looking at an approval for the sterilization of masks. I kept saying to myself, I'd see some of the masks are very complex. We're delivering millions, by the way, millions. But I kept saying, why aren't they able to use that mask a second, third, fourth time? And
You got to change them throughout the
Mike
day because they get
DeWine,
clogged
the
up.
great
If you can
governor of
clean
Ohio,
them,
called me. They have a company that is
And
in the
it's
final process
sanitized?
of getting approval for the sterilization of masks.
mean, is it better than
And in some
nothing?
cases, depending
It's still
on the
infected?
mask,
I don't know.
some of these masks are very, very strong, very powerful, very strong material. They're able to sterilize the mask up to 20 times. So that's, I guess, like getting 20 masks. And
It's also a process.
so we worked
but-
on that as soon as I heard from Mike today. I
Very
got involved,
concerning
and the
things about
FDA is
certain
now
supply
involved, and we're
chains,
trying to
so-
get a fast approval for the sterilization of masks. That would be a tremendous difference. It would be really helpful. While much of the research has to be done, we have a lot of research left to do. Obviously, this treatment on plasma has shown promising results in other countries. We're in communication with other countries, and very strong communications, and they're very reliant on us in just about all cases. We have the greatest people in the world. They're very, very anxious to find out how we're doing on our different things, whether it's a cure or whether it's really anything having to do with getting people better. We have some interesting things will be announced, I think, over the next few weeks, but we'll see what happens. They're being tested right now. The vaccines are moving along very rapidly. The vaccines are an answer, but I'd like to see if we could do something therapeutically so that we could take care of the people that are already sick. And we're working on that at a level that people would be amazed. These are incredible people. They don't stop. This method
Oh, we're flashing.
also has been used for more than a century, and that's the blood-related therapy. More than a century to fight off infectious diseases, so it's not unusual. Our level of complexity has changed, but it's a concept that's been used for a long time, including during the Spanish flu epidemic.
Say you're not a doctor.
And that was really
I'm not a
a
doctor.
pandemic of proportions like, frankly, nobody's seen until what we're facing now. That was in 1918. You know what the result of that was? Probably from 75 to 100 million people were
Lost.
killed. And also other viruses like the one in this outbreak. This is a very tough one. This is a tough one because it spread so quickly, like nothing we've seen. It spread so easily, so quickly. We're unleashing every tool in our nation's vast arsenal, economic, if you look, medical and scientific, military, homeland security is working very, very hard with all of them
It's time people got to
in
come
order
together.
to vanquish the virus. As you know, every level of government, state, local, and federal, is working nonstop to obtain more personal protective equipment for frontline workers. We're delivering vast orders of this material. I'm going to ask a couple of the people here to join me that both make it and deliver it. Joining us today are the leaders of America's largest distributors of pharmaceuticals and medical equipment, including McKesson, Cardinal Health, Henry Schein, Owens & Minor, Medline, FedEx, and UPS. We just concluded a very productive meeting about ways to keep our supply chains and delivery systems moving at top speed. And maybe I'd like to just ask for a couple of minutes for Mike Kaufman to come up, and maybe Ed Paseka. Mike is with Cardinal, and Ed is Owen & Minor. But I appreciate, and if anybody else has anything, please come up. But if you could come up, Mike, for a second, and Ed for a second, just you could maybe say what you told me before when we had the meeting. Thank you.
All right. That was the president's opening remarks from yesterday. And again, the big thing we have to take away from this is that the president is extending social distancing guidelines through the 30th of April. So it looks like we're going on for about another month. I've heard different people speculate that he would come out and say, oh, okay, we'll do another week, we'll reevaluate, we'll do another week. Here's the thing. He straight up was seems to be erring on what the people are telling him. Again, he's a business dude. He's a business dude. He's been doing this for a long time. He's more of an economy and interworkings between business. He's not a doctor. But it does seem that the president is erring on the advice of medical professionals, and I can respect that. So, again, it looks like we're going to be continuing on kind of how we are, with basically the more essential services being open. Everywhere else is basically more either delivery only, this, that, basically not allowing large groups. Don't be going out there and having parties. It's probably not wise and everything. Again, I'm not a doctor. I'm just relaying the good word. So, hey, thank you all for watching. Take care, everybody. Peace out. And long live the elbow bump. Man, we